This week at Children's Health Fund, we published a policy brief on our website that addresses and offers solutions for the growing youth mental health crisis. This is not a new crisis. However, we're publishing this now is because this crisis has been growing for 15 years, and with the recent policy changes and upcoming policy changes at the federal and state levels, we're very concerned that we're about to go off a cliff from which there may not be any return from unless we start addressing the problem now. Did you know that 1 in 5 children in this country suffer from a diagnosed mental health condition? 1 in 5, and that's just the diagnosed children. So many more languish with depression that's not quite clinical depression or not recognized as clinical depression. So many more suffer with anxiety because they don't have a place to learn how to regulate those emotions. So many kids are in school who have attention deficit disorder, but not the hyperactive part. Therefore, they're unrecognized and they're passed from grade to grade, even though they can't focus. So like everything else we do at Children's Health Fund, we focus on the needs of kids, whether it's a medical need, a dental need, and in this case, mental health need, and of course, social service need, because we know that the future of our country, if we really care about a strong country, a strong nation, then we should really care about well-being of our children and youth. I know it's a cliche, but they are the future. What kind of a future are we going to have if kids with depression aren't getting management? What do you think is going to happen? Well, what is happening is more and more kids in the last few years are going to emergency rooms with issues of severe anxiety, panic attacks, depression, in some cases suicidal ideation or even attempts at suicide, in unprecedented numbers. Why are they doing that? They don't have anywhere else to go. Or nobody's listening to them, nobody's recognizing the problem until it gets so severe that they show up in emergency rooms. And emergency room doctors themselves will say, this is not really the place to manage these issues. We can literally and figuratively put a Band-Aid on it, but the problem doesn't go away. We need to come up with innovative solutions because right now we don't have enough mental health providers. So there are some programs, like the art therapy programs. We have one in Los Angeles with our partner program there at Cedars-Sinai Medical Center, where they're coming in and providing an art therapy program to help kids affected by the Los Angeles wildfires from 2025, last year, address the trauma and their emotions around that. Because if they don't do that, what do you think happens? Well, that trauma is with them lifelong, and it comes out, it manifests itself in ways that are not healthy. And we also have, through our Healthy and Ready to Learn program here, where we address health barriers to learning in New York City schools. And one of the ways we're doing that is by bringing a tele-art therapy program, a proven model that helps kids learn how to regulate their emotions, and it helps identify children who have a more severe emotional or mental health condition that needs further attention and refer them through the use of community health workers and school personnel. The school nurse in particular helps them find someone that can help address that issue. Policy changes at the federal and state levels that have already happened and some that will take effect this year and into 2027 are about to push this crisis off of a cliff from which we may never be able to return unless we start doing something about this now. When I say doing something, I'm talking about changing our systems in a way that they help children, not make life harder for them. Changing our systems where kids who are struggling with issues like anxiety or depression, or who have a diagnosed attention deficit disorder, can get a provider, a mental health specialist in their community to help them navigate and manage their condition so that they can thrive and succeed in life. That's who we are at Children's Health Fund. We care about every kid in this country, regardless of their zip code. We provide healthcare services through our national network of 24 programs in 15 states, Puerto Rico, Washington, D.C., by bringing the healthcare services through mobile clinics, school-based and other community-based clinics, and through telehealth, bringing those services within the communities where children live, learn, and play. Last year, we served, through our national network, more than 130,000 children and families through nearly 500,000 clinical visits. We can do a lot more with the right support, and we will this year. However, to make a sustainable change for all kids in this country, we really need to think hard about what it is we're not doing on their behalf. Number one, we need to make sure that we have systems in place that encourage for the screening and identification of mental health issues. And second, we need to make sure there are services available for kids who are struggling with mental health issues. You can't have one without having the other. It's not going to work. And the way to do that is to change policy that A, reimburses providers to do the screening, and B, reimburses at the right levels providers, psychologists, licensed clinical social workers, psychiatric nurses, and other mental health providers to take care of the kids. We can't do it alone. With your support and your partnership, we can figure this out and talk about what is really needed to change the systems to make sure that every child in this country has the opportunity to grow as healthy as possible, to thrive and succeed in life, right? Isn't that what we all want? It should be, if we really care about the country. So thank you for listening. I implore you to please take a look at the policy brief, send us ideas, give us feedback, and like always, we appreciate your support. Thank you.